When it comes to accurately representing doctors on TV and in the movies, Hollywood doesn't always get it right. What's up everyone, Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today I want to dive into a few common ways that Hollywood misrepresents the medical profession. So let's jump right in. Number one, doctors only see one patient. So this is a common theme, especially in medical dramas, where you'll have an episode that revolves around the experience of just one patient. And then in the episode, they'll get into how the doctors are meeting behind the scenes to try to figure out what's going on with the patient. There's probably going to be some drama with the patient and maybe some of the patient's loved ones, or maybe some drama in between the doctors themselves. But in any event, we're just talking about one patient. And this really changes the structure of the whole day. There's not really any rounding where doctors go room to room to see all their patients. There's just a lot of sitting around, pondering, trying to figure out what's going on with that one case. And so this is drastically different from reality, where a doctor will see anywhere from 10 to 15 patients in a day. That's a hospital doctor. Clinic doctors will see even more, maybe closer to 30 patients. And the whole day is structured totally differently. So when I show up in the morning, the first thing I do is I open up the electronic medical record and I'll look at, let's say I've got 14 patients. I'll pull up all the charts for all 14 patients. I look at all their vital signs, all their blood test results, make sure everybody's stable. Then I go one by one and then do a chart review. So I figure out what sort of treatments have been tried before, what's going on with the patient, what kind of diagnoses does the patient carry already, and I form in my mind a general idea of the plan of care about how we're going to address this particular patient's concerns. And then once I finish that for all 14 patients, then I go room to room in the hospital and spend about 2 hours usually seeing each patient, doing a physical exam, and then trying to answer all their questions during that time. Then after that, I put the patient care into action. I make phone calls with specialists. I'll talk with the nurses. I'll put in orders. And so it's all very regimented to manage a service that's a little busier, right, with 10 to 15 patients. That's totally different from what you see on an episode of House, for example, where the whole day is just kind of spent talking about just that one patient. So that's definitely I would say a misrepresentation, but maybe a necessary one, because nobody would want to watch a show where you just kind of scratch the surface of 14 different people and there's no real character development, because that's what would be the case if we try to be a little more accurate in representing a day in the life of a doctor, at least a hospital doctor. Now, I will say, and maybe I'm not proud to admit this, but I was a fan of medical dramas, especially House and also Scrubs. And I definitely had that in mind when I applied to medical school, that it was going to be like a bunch of detective work the whole day to casually review just one patient. Needless to say, I was in for a surprise when I found out how things really were. All right, let's get into the second way that I think Hollywood sometimes misrepresents the medical profession, and that is in the idea that doctors do everything. I'm talking about transporting patients, doing our own blood draws, checking blood pressure, vital signs, doing all the procedures. Sometimes you have medical doctors who are even scrubbing into the OR, doing surgeries. I've even seen episodes where the doctors act as detectives going out in the community, going to the patients' homes, trying to find some sort of weird mold underneath the refrigerator that could be causing an obscure illness. So we like to perpetuate the idea that a doctor really is a Swiss Army knife of a human being and can just do everything. But that is just not the case. Medicine is very highly specialized, and you have different professionals performing each of these different tasks. So the nurses will handle the IV. They'll do a lot of the legwork in the hospital, check vital signs, do procedures like the IVs, of course, but also placing NG tubes. A lot of the hands-on work is done by our nursing staff. And then you get specialists like respiratory therapists that focus on breathing, oxygenation, ventilators. And then you've got physical therapists working on strengthening, speech therapists, which assess not only speech, but also swallow function. So all these different roles that are not done by the doctor. And in most cases, you're not going to have medical doctors scrubbing into the OR. Although maybe the inverse is true. Certainly OR doctors or surgeons will also round in the hospital Yeah, I can't even. I can't even remember the last time I scrubbed into an actual operating room case. I've done bedside procedures, but actually going into the OR is not something that a medical doctor would routinely do. So I do think that that's a bit of a misrepresentation when Hollywood or the film industry likes to say that the doctor is just going to do all the work, everything that needs to be done in the hospital. And I think patients sometimes see this and they come into the hospital with the idea that all their care is going to be done by the doctor. So they'll say things like, hey, wait a minute, I don't want a nurse to place my IV. I want the doctor to do it. That's a big mistake because doctors don't have a lot of experience doing these. I've only placed like probably 5 or 6 IVs in my entire life. I've done more central lines, I guess, because that's what we learn in residency. But peripheral IVs, we just don't do it a lot. Whereas nurses do hundreds, maybe even 1,000 plus. So they're the real experts at this. But I think that the way the film industry represents doctors doing everything can sometimes give people the wrong idea. Now, moving forward, number 3, another way that I commonly see some misrepresentation going down is with CPR. So CPR is a common thing because it's obviously very dramatic. That's when you do chest compressions to try to save somebody's life who has suffered a cardiopulmonary arrest. And so you see all kinds of mistakes in the movies. One of them is the wrong interval. Sometimes you see the person only doing a few chest compressions and then trying to do rescue breaths. That's not the way it should be done in real life. You got to do 30 at a time, so much longer duration of chest compressions. You also commonly see the compressions being done at a rate that is too slow, because the real rate is really fast. When I was in med school, we used to say 100 beats per or 100 compressions per minute. But then recently, the American Heart Association actually changed it to 100 to 120. So you err on the side of going faster. The point of this is you're really trying to optimize blood flow. That's what you're trying to do. You're pushing down on the chest, causing extrinsic compression of the heart to force blood to move through the body when the heart isn't pumping. So a faster rate is better. You also sometimes see compressions that are not deep enough. Just these real, the Hollywood, because you want to look good when you're doing it. You got the little wisp of hair going down your eyes, doing the compressions really dramatically. You're not doing it with enough force. So that's another thing that we see. Actual compressions are violent. You're compressing the chest 2 inches, actually 2 to 2.4 inches deep. The chest wall is not a wet noodle here. It's muscle and bone, and it's hard to compress the chest that much. You really have to get into it. You will work up a sweat if you do CPR for any prolonged period of time. And so sometimes I don't think that we see it done aggressively enough in the movies. Okay, there you go. There's some common misrepresentations of the medical profession that I see in film and TV. As I was making this video, I thought of a few more, so I'll probably make a part 2 to this video. I could probably even do a part 3 sooner or later. But yeah, I hope you enjoyed this video. If you like medical content like this, feel free to hit the subscribe button there or check out another video right here, and I'll see you guys next time.